19. Sure.
Okay, we started, huh? Hello, everyone. It's 10 a.m. and we're going to start right away with our tech talk today, all about childbirth in Switzerland. We have here three amazing midwives. You've seen them on the photo in the registration, so you already know them a bit. This is Jana, she's a Spugler herself. This is Sarah, and this is Serena. They're both Swiss, and all of them work already now as midwives in hospitals and birth clinics. We've received some questions already during registration. So the girls will answer those in the end. First, we'll have their presentation, whatever they prepared for us, and then at the end, we'll go over the questions that were sent to us in the registration form, and also we'll cover the questions that you will send to us in the chat. Feel free to write those. I will be on the lookout for them, so we'll make sure we cover everything. This stream is recorded and will be shared afterwards with all Googlers and Spooglers. So I think that's all you need to know, and we can start.
So welcome also from our side, and a special thanks to Asia who organized everything for today. And it's a pleasure to be here, and as of course today, because today is the International Day of the Midwives. So it's very nice to be here. I will start with the topic about the types of the different types of the midwives and what they do in Switzerland. So the midwives here in Switzerland, they work in a lot of different areas, and so one midwife can work in different areas at the same time. So when the different midwives, the types, of midwife is we have some midwife with do pregnancy checkups at home or in a midwife center. Then we have home birth midwives, postpartum midwives, hospital midwives, birth center midwives, and attendant midwives. And about our study, so our study is academized since 2008, and it takes 4 years. It's different to other countries. So, for example, in the Netherlands or in the UK or Australia, the midwives are very independent and are completely responsibility for the pregnancy, the birth, and the postpartum period. And for example, in Belgium, the midwives will take care of the woman during labor, but the birth will do the doctors. And in Switzerland, we are also responsible for the pregnancy, the birth, and the postpartum period, in the most of the time with the doctors together. So we learn in our study the physiology and the pathology, and the main topic of our study is salutogenesis, and salutogenesis means to promote the healthy part of the situations, and even if it's a pathological situation, so we always try to normalize the pathological situation to a physiological situation. So we have also learned the pathology and recognize it, and to take first measures, and of course to get help from the doctors, to talk with them when the situation is pathological. So the difference to the doctors is that the doctors learn almost just the pathological part of the delivery. Now I would like to tell you about the pregnancy checks in Switzerland and the opportunities of the pregnancy checks. So you have the opportunity to do it just with a midwife or just with a doctors, or you can do it do a combination. So with a midwife, it's the advantage is that you get 1 hour. In the most of the time, you get 1 hour, and they will check the medical aspects and the psychological aspects. So and the to ultrasound, they also highly recommend it. So and then the ultrasound you will do with your gynecologist, or if you don't have a gynecologist, the midwife will do a referral, so that you get the ultrasound as well. If you do it with a doctor, so unfortunately they have in the most of the time less time for the pregnancy checkups, and yeah, they do just the medical or almost just the medical aspects. So the pregnancy checkups from midwife, they will paid from when you up from the 12th week of pregnancy. And when you do it with a doctor, the pregnancy checkups are paid all the pregnancy. So if the opportunity of combination is that you can do one with a doctor and the next checkup with a midwife. So you can choose how much you will do with a midwife and how much you will do with the doctor. I think it's a very nice thing to do when you can do it in combination. And my last topic from my side, it's about the birth preparation courses. So when they are led by a midwife, the insurance will pay 150 Swiss francs for the course, and there are a lot of different courses. So, for example, there are just normal preparation courses, or hypnobirthing, or yoga. So there are a lot of possibilities. So I think you have to check in the internet, and then you will find the right courses for you. And then it's so you can do it. You can do a birth preparation course individual, just you and your husband. So with a midwife. So then most of the time they come to your home and will do a preparation course with you, just with you. So then you're just three of you, or you can do it in groups. And the groups, sometimes they are just women or just men, or with couples, or sometimes there are the possibilities for women who get the second child, because they don't need the same preparation course as a woman who get the first child. So then there are sometimes the possibility. So the informations about the preparation course you get on web pages of the hospitals, or sometimes if you have a midwife for the postpartum period, sometimes they will do also preparation course. So sometimes it's worth to talk with her previously, so to maybe you can do a preparation course with your midwife, and then you already know the midwife who come to your home after the birth. Yes, so I will give you.
Yeah, so if you have some questions about this part, you can scribe this in live chat, and we will answer it after our topics. So now we talk about delivery, and in Switzerland you can have give birth at home or in small birth center, Geburtshaus, or to choose and to give birth in hospital. And what you need to know is that in Switzerland we have a hospital with neonatology department and without neonatology department. If you have some difficulties during the pregnancy or you have early delivery, so you need to go to hospital with neonatology department. After birth, you can stay at the hospital up to 3 days if it's normal birth, so vaginal birth. And if you have C-section, you can stay up to 5 days and more if you have some difficult situation. Pros of hospital birth is so neonatology department in the part of hospital. Anesthesiology team, it means you can have more painkiller and epidural anesthesia, and you can have C-section if it's needed. And cons of hospital birth, hospital delivery is that hospital works with shifts basis. It means if you have the first child, it can be that at the morning you have one midwife and in the evening you have another midwife who support you. Another cons is that the doctors will do more checkups on you because in hospital we have a really big team, so they need to know that you are in the good position and have good support, and it can be pros, and in another situation it can be cons of hospital delivery. So if you plan to have birth in Geburtshaus, in small specialized birth center, you need to have physiological pregnancy, so pregnancy without difficulties. You need to sign a contract with Geburtshaus, with birth center. And you need to do the part of checkups, as a pregnancy checkups by the Geburtshaus, by the birth center. The same is by home birth. So you need to have the contract with your midwife, to find some midwife, to have the contract with this midwife and do the part of your checkups by this midwife. If everything is fine, the birth center or your home birth midwife will clear you for home birth or for birthing in Geburtshaus, in small birth center. But if you have in the middle of checkup some problem during the pregnancy or something will be happen, your midwife or your midwife in Geburtshaus, in birth center, will send you to the doctor or to big hospital. The same is during delivery. If something will be not in the good position, so not physiological, the midwife will go with you to the hospital. If you need C-section, she will prepare you for C-section before. So she will call the hospital, say that you need C-section, and during you go with midwife to the hospital, she will prepare you to give some medication or to see what you need in this time, and will prepare you for C-section. Pros of Geburtshaus delivery or home birth is that it's more intimate atmosphere. So you have not so many people who support you, not so many doctors who comes and goes from your room during delivery, you still have the professional team who knows what to do in special situation. The part of midwives who do in home births have ultrasound scan certificate. It means they have ultrasound with they take ultrasound with at home. Yeah, with and they always control the heart beating of the child. And another process that the same midwife who support you during the pregnancy, birth, can support you after birth during postpartum period. So, and cons about Geburtshaus delivery and home birth is no anesthesiology team. It means if you need some really some painkiller, or epidural anesthesia, the midwife cannot do this. And C-section, you need to go, and for C-section, you need to go to the hospital. So we go now to another part, our presentation.
All right, so I'm going to talk to you about the postpartum, first about the postpartum care with the midwife. So in Switzerland, we call this the Wochenbett. It's just a postpartum time, and it's like the early postpartum, it's 10 days after birth, and the late postpartum is until 12 weeks after birth. So after you delivered your baby and you go home, the midwife will come to your home and support you. And it's quite important for you to know that it's not like a control, that we won't come to your home and control if you're doing everything right. It's more like a visit where we give support to you and give advice and answer the questions that you all have. So who does these visits? Not only midwives do them, but nurses specialized in postpartum care can also support you at home. And what's the structure? What does the midwife do when she comes home to you? We will do conversation with you, talk about breastfeeding, like the breast care and correct attachment techniques, give you advice on breastfeeding problems, support you with insecurities and mood swings. Like postpartum time is always like a lot of mood swings. Give you advice on feeding the infant with replacement food. That's like later on. Assess the uterine involution process and the birth injuries, and if necessary, we will also remove the sutures if you had like a C-section or so. Help give advice on initial pelvic floor exercises, and sometimes some midwives also do the follow checkup with the mother after 6 to 10 weeks, but quite often this is done by your OBGYN or your gynecologist. Yeah. And if you desire, we can also give you advice on family planning, but that's also quite often done by the gynecologist. So with a newborn, we will give assistance and answer your questions about newborn care, and check on the navel and give you advice on the navel care, check on the weight, whether the weight is all good, take blood sampling like the Guthrie test, or check on the bilirubin, give your child vitamin K, and or talk to you about vitamin D, and we can also help you with sling and carrying aids. And it's just, for us, it's quite important to give you support in your own environment. Like, we see what you have in your home, what opportunities you have in your home, and then talk to you about what we can, what you have in your own home and you can use in the postpartum. And there's also time to talk about your birth experience, if it was quite fast or so, or if you have any questions, you can talk to us about birth, and or if you have questions about the newborn's sleeping, waking cycle, or a crying behavior, or just the whole new family situation. We can give you suggestion for dealing with all of that. And if you need support in your home, like with cooking or cleaning or so, you can, with a doctor's prescription, you can get sometimes support. And well, you can always get support. Sometimes the health insurance will pay it. You just have to check with your health insurance. We also give you advice on finding contacts to family networks. There is a lot of opportunities. And to contact to maternity counseling and pediatrician and other specialists, we can give you advice on that. So how many visits are paid in which time of period? So it's quite different. For the postnatal care at home during the first 56 days, so 8 weeks after birth, the following home visits are covered by the midwife, by the compulsory health insurance. So if you had a premature birth or multiple birth, or if you are a first-time mother, or if you had a C-section, you'll get 16 home visits. And if you'll need any more, you get them if you have a doctor's prescription. In all other situations, you'll get a maximum of 10 home visits. So if it's your second child, or but it's always like, if you need some more, you can talk to your doctors, and then he can prescribe some more visits. And if you'll need after the 56 days some more home visits, they are also covered, but only with a prescription. So somebody asked in the questions when to organize midwife. It's quite important to organize a midwife early, because they're always very busy. I can't tell you in this or this week, but it's rather sooner than later. There's a page, homepage from the midwives in Switzerland, where you can just write your citizen code, and then you'll see who's available in your city. It's the hebammensuche.ch, or in Zurich there's also this thing called Family Start, and this is they will organize it for you, and it's paid in Zurich. So as we are with the money, a midwife provides on-call care both around the expected delivery date, so 37 to 42 weeks of pregnancy, and during the postpartum care phase. So that means that once the midwife has to agree to take over care, she must organize her work and her private life in such a way that it is possible to start care at any time. The baby doesn't come at one specific day. So she must always be able to arrange all appointments for scheduled home visits according to urgency or offer additional ones. This service is not covered by mandatory basic insurance. So in Switzerland, there are some cantons or like this that cover this service, but in many cantons, this must unfortunately be financed privately by the mother or couple. I just give you the advice to check with your midwife or contact the website of the section where you are looking for a midwife. Then there's an additional offer, the so-called Stillberatung, the breastfeeding counseling. There was also a question about this, as like breastfeeding can be quite challenging and is a intimate time for everyone involved. And for a positive experience, it needs peace and quiet in the home environment. And if you need some support, there is the opportunity to get so. There are a few different topics that you can talk about in the breastfeeding counseling, like just assess your personal breastfeeding situation. If you have a breastfeeding crisis, strike, or breast refusal, you can talk about this. Or if you have little or too much milk flow, if you have sore nipples, or general pain during breastfeeding, or if you even have like mastitis, you can talk to her to a breastfeeding counselor. And if you like have twins or triplets, and if you'd like to breastfeed and organize this, or if you have a child with special needs, that's also important that it has also special needs with breastfeeding. If you'd like to return to work and want to talk about what's the best opportunity to like maybe do with breast pumping or so, they can also give you advice in general about breast pumps. And if you are trying to add some more food to your child, not only breast milk, you can also talk with the breastfeeding counselor about it. Or if you make the decision about weaning, and they can give you support about weaning. That was one question that somebody asked, that the pediatrician didn't really want to talk about it. It's like, I would give you the advice to talk to a breastfeeding counselor or to the parents consultant center. There is this, like in German we call it Mütter-Väter-Beratung, yeah, and that's also where you can get advice for weaning. And so who does this breastfeeding counselor? So it's provided by certified lactation consultants or specially trained midwives. And you can find it in a hospital or a midwife center, or maybe the midwife who gives you the postpartum care is also doing these, is also a specially trained midwife for breastfeeding. And yes, 3 breastfeeding consultations are covered also after these 56 days. So the entire breastfeeding time period, the basic health insurance will cover the costs of 3 consultations. Yeah. And if you need a breast pump, the health insurance sometimes supports you with the cost of the milk pump. It depends on your situation, and it depends on the insurance that you have. Just really check with them, and check with ask your midwife or your doctors. Yeah, and that's also quite cool that some health insurance give you money if you breastfeed your child for a certain period of time. Like the midwife can subscribe a paper, and then she will you will get some money for breastfeeding your child for a certain time. In the postpartum time, there are also quite a lot of courses, as Sarah said before in the beginning. Pregnancy, there are a lot of courses, and in the postpartum time, there's like postpartum exercise course, which is quite important for a pelvic floor, or there's a course about infant care, or like courses where you learn how to use the baby sling, and many more. Just check on on different websites. Yeah. So the next topic I want to talk to you about is insurance in Switzerland, which is quite interesting for you. What exactly is paid by the insurance, like the basic insurance and like without the franchise? The following maternity benefits are covered by the basic, like the compulsory health insurance, like 7 checkups during pregnancy performed by a doctor or a midwife. Like Sarah said before, at the midwives it's paid after the 12th week. Yeah. And then the delivery at home, in a hospital, or in a birth center is also paid. And to the cost of preparation course, as Sarah said before, it's 150 francs they will pay 150 francs if it's organized by a midwife or a midwife's office or so. And the breastfeeding counseling, as I said before, 3 breastfeeding counselors are paid. And in general, the 16 or 10 home visits, as I told you before, are also paid. So the insurer may not charge cost sharing on the special maternity benefits. Like in addition, from the 13th week of pregnancy and until 8 weeks after birth, women who no longer have to contribute to the cost of general medical service and nursing service in the event of illness. So if you're ill during the pregnancy, you also don't have to pay additionally. Yeah. And then there's another topic I want to talk to you about is the prenatal diagnostic. There are different types of prenatal diagnostics, such as ultrasound, different blood samples, the first trimester test, non-invasive prenatal test, amniocentesis, chorion, Will sampling, and so on. And it really depends on your situation, whether the diagnostic is paid by the health insurance. I just want to give you the advice to inform yourself about the prenatal diagnostic, that there is prenatal diagnostic, and that you talk to your OBGYN about it, and everybody has to decide themselves whether they want to do the diagnostic or not, whether they
Prefer to
if whether they want to know certain things, that you are like allowed to not know things, that you can tell I don't want to know it, and then your OBGYN has to like inform you about it, and you are allowed to say no. And it's important to just think about it like before, or read a little bit about it. Yeah, that's a question I want to give advice to give you. And about insurance, it's also quite important that you organize a health insurance for your child. I think somebody asked about this preparation during pregnancy, and that's quite important that you have it before it's born. It's quite easier for the organization that you'll have it before the birth. Yeah. I think I will give it back to you.
Thank you. So before I start to another topic, I want to say about Beleghebamme. So we don't say it's before, but it's possible if you have early pregnancy, so until 10-50 weeks, that you found some Beleghebamme. It means some midwife who can support you during full pregnancy, birth period and after birth, so in postpartum period. So from first day of your pregnancy until 3 months after your birth. And this midwife work and have some contract with hospital. It means that if you have birth, if you have delivery, you can just call for your midwife and she go with you to the hospital and can stay there until 24 hours with you. Yeah.
Yeah,
I think it depends on the contract with
The contract with the
hospital.
hospital. Yeah. So I think it's really good possibility to do this because of psychological support too. And but what you know to know in Switzerland, it's only 3% of all midwives who working with this system. It means you need really be really early and to contact with this Beleghebamme and to do contract with this Beleghebamme. So, and now I will talk about support system from your Gemeinde, so from your community, or if you are living in the city, from support from your Kreis. So after birth, you have 3 months possibility to always call your midwife and say about your problems, or to say, I need you, you can come home to me, and I have some questions of you, and she will come to you and answer the questions, or to help you with breastfeeding or something like this. And after 3 months, you can always go to Parents Consulting Center. It's Mutter-Vater-Beratung auf Deutsch. It's this center is in big villages. In big villages, they have this Parents Consulting Center, and you can visit it till the kids are 3 years old. So you can go there to talk with midwife, to see your child grow fast enough for you and for this parameter of how the child grows, percentile. Yeah. So you can have the consultation about breastfeeding or some meals for your child. You have possibility to speak about the problems with sleeping. So it's really good possibility to go there and just to talk with another parents and have the contact, because it's the village and you know then other parents, another problem of these parents. Maybe you have the same situation, maybe you have 2 child and another family have 2 child, and you can have contact. Often is so like Gemeinde, so your community can cover the cost of some course, and this course are doing the consulting team in this parents center. So in my village they do massage group for the babies and postpartum course. So it's 10, you need to visit it 10 times to do some exercise for pelvic floor. I found this really good because you don't need to pay this, and you have more 10 hours to go to another course for pelvic floor. It's really fine. Another support from your community is family coaching. The cost pay your Gemeinde. So you need to pay about this, but you need to know that you scribe some contract, that you need to sign the confidentially agreement. So if you say about your family or say about your problem with consulting team, they will not give any information to another people. Yeah. And it's possible that your village, your Gemeinde have psychological coaching too. I found this really good because it's a new situation. If you have first child, it's new situation for your family, it's new life, new start, and you have really more question, more psychological part that need to be supported. So just go to your Gemeinde and ask if they have some support for families. You will give you some card with all numbers and you can call there. So now we go to the questions.
Yes.
Yeah, exactly. So we have here a few questions that you asked us, and I will just ask and Sarah will answer them. So the first one is, are there any benefits of small birth clinics like here's London over big hospitals like the University Clinic or Triamli?
So actually, it's sometimes difficult to answer because it's very individual, and I think the most important thing is that you feel comfortable where you gonna deliver, and that you know in before you get in labor, that you know, okay, I will feel comfortable in this hospital where I give birth. But maybe in a smaller hospital, it's or the benefits maybe that usually, not all the time, but they have a little bit more time for you, and maybe they can be a little bit more individual than a big, for example, at the University Hospital of Zurich. But for example, in Triamli, there is the possibility that you can give birth, midwife-led birth. So you are in the hospital, but if everything is okay, and there is no problems, a midwife is with you, then you give birth just with 2 midwives. And so we, as midwife, we would recognize if there is a problem, then they can get the doctors just a word.
Yeah. And the doctors are just in near room, so they come in 20 seconds.
So I think it's very important that you just inform you before, or can in the most of the hospitals you can have a pre-talk with the midwives, and then they will show you the delivery room, and then you can have a look if you feel comfortable there. And I think this is very, very, very important.
Yeah, and a lot of Geburtshaus or hospital have tea time with midwife, so you can just come and ask the question what you have, and maybe to just to have some how to say the first
Like a conversational
yes,
feeling.
yeah,
what
just
it's gonna
first
be
feeling
like.
it's
Yeah.
fast for you or
Yeah.
not. Yeah.
So in the birthing center, it is special that they wanna do the pregnancy checkups. Maybe it's like 4 weeks before your due date, because for them it's very important that you get familiar with the birthing center, that you come in and you feel comfortable and you feel familiar with the rooms and with the people and with everything. So, and this is maybe a disadvantage to hospital, but in the hospital you have the opportunities, just call them and ask them if you can have a pre-talk, and if they can show you the delivery rooms.
Thank you. So the next question is, do gentle, family-orientated C-section exist in Switzerland? Any tips for moms who know they will need a scheduled C-section due to pre-existing medical reasons?
So I think it's in a small hospital, there can be individual more individual if you have to get if you have a scheduled C-section. And I would highly recommend you to write your wishes on a paper and talk with and have a pre-talk with the midwives in the hospital and tell them what you really want. If the bonding is very important for you, then tell them, and then they will tell you what is possible and where it's a little bit difficult. But I would highly recommend you to have a pre-talk with them, that you can tell them what you want and what's your wishes, and that you know what you want. And but when so when you come for the C-section, that they already know, okay, for her is very important this and this.
Yeah, so can I say?
Yes.
So I work in university hospital, and there is possible if you scribe that maybe the father want to take the child during C-section, it's possible there. So you need just to scribe your wishes. So if you want not to see the baby after birth, it's possible to. If you want to have the baby after C-section, just by you have this possibility if all parameters of health check by the child is good. So it's all possible. Just need to scribe this and say what you want.
Yes, I think it's a lot of things is possible if you tell the midwives there.
And not just on the day on birth, on the birth date, but also before. Just talk to her, as Sarah
Yeah,
said.
or send a mail just for your
Yeah.
hospital with questions, and they will answer all the question what you have.
I think it's important to comment if it's also covered by basic insurance or not, all of these things, or is this only possible with private health, private?
So I have the last 2 weeks I have 2 cesarean checks, and it was allgemein, so it's normal insurance, and it was possible too.
But the pre-talk, do you mean the pre-talk?
No, I meant all the like wish list.
Ah, yeah, that's also
Yeah.
All,
Yeah,
like, if you're
Everything
basic
is covered.
insurance.
Yeah.
So the next question is about a woman who is currently pregnant with her first child during July, and she's feels a little bit lost among all the info. So she has quite a few questions. So she has questions about the pain relief during the childbirth. Like, could she choose epidural or gas and air at a later point during labor, or does she have to decide before?
So actually, you don't have to do previous decisions, because maybe at one moment you are very okay without a painkiller, and then maybe 10 minutes later you say, no, it's not possible, I need something. Then it's absolutely okay. Then we will give you something. So it's not when you say something previously, then it's like this. So it's just we take care of you, and we always be with you, and when you need something we will give it to you. So you don't have to make decisions previously about the painkiller.
And another question, if the baby is in breech position, is there any chance to deliver it vaginally or naturally?
So yes, it is a chance, but it's necessary to have a pre-talk with the doctors, and with the doctors in this hospital where you gonna deliver, because not every hospital do breech vaginal
breech vaginal
yeah,
birth.
sorry. And so it's very necessary that you have a pre-talk with the doctors and have the checkups, and then they will support you and will say you everything what you need, and when it's possible or when it's not possible. And we have in Switzerland some doctors in a hospital. They do an external cephalic version from the 35th week of pregnancy. So this is an opportunity, but yes, I think important is that you talk with these doctors from this hospital where it's possible to deliver a breech, and and then they will tell you everything about the delivery and do the checkups and talk with you.
And can I say something? So if you have child in the bridge position, it's not means that maybe this child stay in this position during delivery. So it's possible that something happened during delivery and the child will take another position. Or you can contact your midwife and she knows some tips, how to say, something like this, and show you what you can do during the pregnancy that the child can do another position.
Yeah, so actually the position of the baby can change until the due date.
So are this one or?
Yes.
So are there any recommendation regarding birth preparation classes?
So I already talked about the preparation classes, but this woman who asked these questions, her due date is in July, and I would recommend, if the due date in July, so very close, I would recommend to do an individual preparation course with a midwife. So because sometimes the courses started a little bit later, if you do an individual course, you can do it when you want, whenever you want.
Okay, so the next question. I'm more curious to know what are the common practices here in Switzerland and if they are familiar with late pregnancies. I'm concerned about all stigma that exists with late pregnancies.
So actually, there is no problem in Switzerland. A lot of women are over 35 or 40. So we have a very high standard. So this is no problem to have a baby or with late pregnancies.
Okay. I'm now pregnant. Expect visiting the doctors, contacted the friends who had babies to reserve towels, clothes, informed my insurance advisor about the coming baby. I don't know if any other mandatory things that I have to do in preparation. Could you kindly advise?
So actually, I think nothing is mandatory except of the health insurance, and but it's I would recommend to organize a midwife for the postpartum period, as Serena said before, and as I said before, just have a look where you're gonna give birth, that you feel familiar with this place.
Is there anything we should know about twin birth in Switzerland or how the NICU functions, which is different than in other countries?
So actually, you can deliver vaginally also twins if they are in the right position, and so you have it's like breech position. So you have to check before which hospital will do it, and yes, and of course you can get the C-section. Sometimes it's necessary to get the C-section because of the position of the babies. Usually, so if the babies deliver at due date, also twins, so usually you don't need a NICU, so it's no problem to deliver or to get the C-section in a smaller hospital without a NICU. And if you need a NICU, I would highly recommend you to be in this hospital, which it's the closest from your home, because it's a tough time. And I think then you shouldn't have to travel 1 hour until to the NICU.
So, what does basic insurance cover, as I had Halbprivat when giving birth?
So actually everything is covered, and you will get a room just with 2 persons in there. So no, not more, 1 or 2. And so, for example, in the hospital where I work, there are the possibility of a family room, and the family room is that you can that you get a room just for you, but then it's mandatory that that your husband or your partner will stay overnight there and support you. And if you are Halbprivat, it's less, you have to pay less than if you're allgemein. And in this hospital where I work, there is, if you are private, is the family room for free, and Halbprivat a little bit less. And yes, so, but it's mandatory that the husband will stay overnight, and yeah, that you can be there as a family.
So the last question that you wrote us, what tax benefits or financial help might be available for foreign unmarried parents in Switzerland?
So I have 3 child. I can say that you have only support with 300 francs for your insurance, for kids insurance, and no more tax or something that will be paid. Because in Switzerland, I think they are of this position that both parents, married or unmarried, have the same, same possibility to help the child to grow up and to support with money and and another. What I forgot to say about home birth. So it's about insurance too. So if you have private insurance, so if you plan to have home birth, you need to pay on-call compensation for your midwife. It's about 700 until 1,000 francs, and it will not cover from normal insurance. But if you have private insurance, it will cover the part of this money. Another part will covered from your Gemeinde, from your community or Kreis in your city. And another part is after birth, after home birth, your insurance, if you have expensive insurance like us, Helsana or Swika, they will pay some money back because the home birth is much more cheaper for insurance as the birth in the hospital. So I know the last time from Swika it was 2,000 francs back. So it's good, I think. So we go now to questions. What you think for us? Oh,
Yeah,
good.
I can read those for you.
Yeah. So you need.
I need the microphone. Is it necessary during pregnancy to be tested for possible genetic diseases of a child? And a question that goes together with this one, is prenatal testing covered by insurance? When is it normally done?
Yeah, maybe you was.
Ah, yeah, that's my thing. So the first one is about genetic disease. So it's not, that's a thing that you have to decide by yourself, because I don't want to give you advice. It's like it's possible sometime, and that's important to talk to your doctor about it, that you think about it quite good and think, what do I want to know? What are the consequences if I know something? Just do these, think about these things. And the other is that what is covered. So there is this first trimester test. This is always paid,
covered,
covered by the basic insurance. And if there is like a high chance of like some kind of trisomy, the other non-invasive prenatal test is also paid, but that's better to ask your gynecologist. They will know.
So actually, maybe there is to say, so there is a high risk if the first trimester test is 1 to 1,000. So the risk is maybe, for example, 1 to 800. So it means that you have to get 800 pregnancy, 799 pregnant, and one is then, so that you know what
What it means.
what it means. So
Like what means high risk?
high risk,
Yeah,
yes.
high risk is when it's like the risk is under 1 to
Yes.
1,000.
Yes.
And if you think, okay, for me it's not important what is with the child, I will do this birth. So maybe you don't need to know about this test. So you need just to think about what you want to know and what you want to know after birth.
And it's quite important for you. It's quite important for you to know that you have the right to not know. Like it's not always. You don't always have to know what's going on with your child. Yeah.
And the same with ultrasound, ultrasound diagnostic. So you can say, I don't want to know, it's a boy or girl.
Yeah.
You have right to say this.
Yeah.
Thank you. There's a couple, a pregnant couple is moving to Switzerland around the end of the second trimester. And what would be your advice to them on things to be aware of or probably to plan for?
Yeah.
So first, I will say, found some pregnancy centers or midwifery center near of you and just go there, because the midwife have enough time for you just to explain what you need to do and what is the next step, what you need to do with this pregnancy. And she knows the doctors in your area, so she will send you all the possibility, the all hospital in your area too. So I think that the better choice is just to go to the midwife, have this contact, and she will talk for you all possible,
And
all
give
what
you
need,
the support which you need. So
And maybe like write your questions down, that you have them all covered after the check, like the talk to the midwife. Yeah.
and it will be covered with your insurance, and I think it's really good.
Another question. I'm pregnant in week 8, almost 9. Next week, the lady goes to the gynecologist. Does it mean that the appointment and blood test will not be covered by Helsana? Did I understand correct?
actually, no, it's covered because it's when you do the checkups, unfortunately with a midwife, then it's not covered. If you do the in from week 1 to 12, but if you do the checkups with a gynecologist, it's covered even if you are in the 8th or 9th week of pregnancy.
And 2 last questions so far. Maybe someone will write another one. Hi, everyone. My little one is 6 months old. We would like to do baby-led weaning. Do you have any recommendations? And another question also from the same mother, we have issues about sleeping and nap process. Do you have recommendations? We don't like to let the baby cry. So baby-led weaning and nap sleep.
So just from my part, it's quite hard to just give you some advice if we don't know the exact like situation. I would recommend to either how old is it? Did you say
6 months.
6 months? To go to the
Muttervaterberatung.
they are really competent about with this topic, and or about the baby-led weaning, talk to a breastfeeding counselor about it, because they can like look at your situation that you are in, and then you can decide what you want to do. And with the baby crying, it's also good to talk at the Mutterväterberatung. Yeah.
Yes, and at the moment you can get at the Mütter-Väter-Beratung also, I think it's because of Corona anyway, but you get call support. So you can just call them and then they can get support on the phone. So
they come at home too. I know.
yes,
Yeah.
so they come at home, but if you are no time to go anywhere, so you can get at support at the phone call.
And in at some places you even get support from 0 to 5 years, like for like all the questions you can ask them all the questions. Yeah.
Yeah, well, that's it for now. All the questions are covered, hopefully. Yes, yeah.
Okay.
I have them all, yes.
Oh,
May I ask you to maybe can the participants or somebody who watches the video afterwards, if they have more questions, can they write them to you, to maybe through me, probably? Yeah, so if anyone has more questions to Serena, Sarah, and Diana, you can write me. I will provide my email somewhere. So yeah, you can get some more support, because pregnancy and childbirth is very worrisome, and you don't always, kind of know what to do. Right. So thank you again. Congratulations again on the Hebammentag. This is an important job that you're doing. Thanks for doing this. Yeah. Have a good day, everyone.
Have a good day.
Bye.
Bye.